Unsurprisingly, Joe Biden does not support Medicare for all. Also, unsurprisingly, he doesn't have a good reason for it. So, much like many of the things that come out of Joe Biden's mouth, it makes you raise an eyebrow. Watch.
What do you say to calls for some sort of universal health care or something like Medicare for all from some of the other people running in the Democratic primary?
I think they're well intended. I think they mean it, and it's not. I'm not. But here's the deal. Right now, you have this overwhelming number of employers who are paying into the health care plan. Why let them off the hook? All of a sudden, they don't have to pay anything. What happens then to this whole thing about profit and the rest? I mean, it should be part of the compensation if you have it.
I don't know what this means. I think I know what he's trying to say, but it doesn't make any sense. I mean, Joe, if you're going to take money from insurance companies and big pharma, at least have some kind of reason that is somewhat justifiable, even though there really is no good reason to not support Medicare for all. But at least, I don't know, say the same things that other candidates are saying about Medicare for all. Pretend, try. This reason doesn't make any sense. Letting employers off the, why are we letting employers off the hook by giving everybody health care? It's ridiculous. So the reality is a lot of employers are not raising their wages because they are deciding instead to give people health insurance. Now, what does that do for the employer? Well, it makes a lot of people stick with that employer, even if they don't want to be there. So say somebody hates their job or hates their boss, hates the people they work with. Maybe they want to start a business, but they have health insurance with their employer. So they stick with that job. Even though they're unhappy, they know they're going to live because they have health insurance. So having private insurance guaranteed by an employer is actually a huge boon for the employer, not the employee. Under a universal system, under a system like Medicare for all, it would actually give the people freedom. You would have the freedom to move to a different job, to start a business, do something else, like I do in Canada. I never had to think about healthcare when I left my old job. I already have it. It's guaranteed to me. So let me go a little bit more into, this isn't news. Companies have been using healthcare as a way to not give people raises. So let me show this story from 2015 from the Washington Post. Companies have found something to give their workers instead of raises. More businesses are upping their spending on benefits such as one-time bonuses, healthcare, and paid time off, according to recent survey data. Many are rolling out perks such as free gym membership, commuting subsidies, even pet health insurance. So this is what employers do. Instead of giving you a raise, they give you some other benefit. Oh, free gym membership. Oh, you got health insurance, so now you're stuck with us for life. So many great benefits here at our company. Oh, I know you want a raise. I know, yeah, the cost of living is going up. I know. But you don't have to worry about your pet getting sick. So on top of that, you still have to worry about deductibles and copays. Again, out-of-pocket expenses. You still have to worry about paying for healthcare, even if you have the private insurance. So let me read this from Vox. New data from the Commonwealth Fund shows that the percentage of workers who do receive insurance through work but are nevertheless considered underinsured, meaning they could still have to spend a significant amount of their own income on medical care in a given year, has nearly tripled this century. So look at this data. Workers with a deductible of $1,000 or more has increased to 51% since 2012. Again, these are workers, people that have health insurance through their employer. So 51% of them, their deductible is $1,000 or more. And those with a deductible of $2,000 or more or $3,000 or more has also increased since 2012. So the answer here is Medicare for all. It's a system where there is true freedom. You still get to pick your doctor, as Canadians get to pick their doctor. You have the freedom to leave your job if you want to, start a business, do something else. The healthcare is always there. It's free at the point of use. You never have to think about it. The costs are lower through your taxes than they would be to a private insurer. I mean, the idea that I would have to pay $1,000 through a deductible to get healthcare in America, even though I have private insurance. I mean, this is a crazy system. This is a system that prioritizes profits for the healthcare industry over actually helping people. The whole point of a universal system is that it prioritizes helping people. But when you have healthcare within this capitalist framework, yeah, it's going to continue to get more expensive for people because it's capitalism. That's the whole point. They want to make profits. So how do they make profits? They deny people coverage and they raise your copays, deductibles, all this crap simply because they want to make more and more money. None of this exists under a Medicare-For-All system.